It's hard to believe that something as tiny as virus could break a marriage. But I hear about this almost every month in my clinic. I have seen couples walking in hand and walk out in tears, not because of infidelity, but because of misunderstanding. Hi, I am Dr. Manoj Chakrabarti, and as a doctor who worked with thousands of incredible patients, I've realized something powerful. Science takes time to reach people's heart. It took centuries for us to accept that invisible germs cause disease. And even now, not everyone believes that a virus like HPV can cause cancer, stays on 3 out of 4 human skin. So today, I want to change that gently but clearly. No scare tactics, no shame, just science made simple. Because when we understand the truth, we not only protect our health but also our relationships. Let's talk about the tiny virus stirring up big trouble and the 5 biggest myths about HPV that might be costing us trust, peace, and sometimes even lives. But first, 2 quick things for those new to HPV. HPV, what is it? HPV stands for Human Papillomavirus, a tiny virus that can silently cause cancer, often without symptoms. Out of over 600 different viruses causing diseases, HPV alone has got nearly 200 subtypes, and about 3 in 4 people catch it at some point in life. Most don't show signs, which makes it sneaky. HPV can cause around 6 types of cancer. Thanks to decades of research, vaccines exist to protect against it. In 2008, Harald Zerhausen won a Nobel Prize for discovering HPV's role in cancer. Understanding HPV helps you stay ahead and healthy. Next, where exactly lies the problem? It is surprising that even today, a tiny virus can cause such deep rifts between couples. Stranger still, our constant push for health awareness has, in HPV's case, been undermined by half-truths and misinformation. When I returned to India from England a few years ago, I was struck by how little people knew about HPV. By then, in UK, every schoolgirl routinely received the vaccine, and now boys do too in many progressive countries. In India, awareness about both vaccine and the virus was almost nil. I hoped people would one day speak openly about it, and I did my bit, writing on social media, teaching patients. But in a country this vast, one voice only carries so far. Thankfully, things have improved. Vaccine makers, their PR teams, and sponsored medical conferences have helped spread the word. Today, thousands in India choose HPV vaccination through private healthcare, paying out of pocket. For young girls, it is now seen as just another routine jab, a welcome step forward. How deep do the roots go? Here is where it gets complicated. A woman in her 30s or 50s tests positive for HPV and confusion follows. We have built awareness about vaccine but not the virus. The moment HPV appears in wife or girlfriend's report, many rush to Google. It says sexually transmitted infection and suspicion sets in. Has she had another partner? Trust crumbles and sadly, some relationships don't survive. I have seen tears, angers, and heartbreak in my clinic, all stemming from poor scientific understanding. Many couples have bravely shared their struggles, and I deeply respect their openness. Without them, I wouldn't grasp the full depth of this issue. Public awareness about HPV should come from health departments too. Seen any ongoing campaigns or billboards lately? I haven't. Have you? Myth number 1. A positive HPV test means my wife has got multiple partners. Before going inside your home, let's rewind the medical science to understand it better. It's taken science an astonishing long time to prove that a virus can cause cancer, and even longer for that knowledge to filter down to doctors, textbooks, medical colleges, and finally to general public. Even scientific breakthrough moves slowly through these stages, and meanwhile, misconceptions tend to live comfortably in the camp. Women continue to suffer first. Let's bust this one straight away. Many assume that if a wife tests positive for HPV, it means she had multiple sexual partners. Panic search on Google, and the first thing you see, HPV is sexually transmitted infection. Not exactly coming, is it? The thing is, Google isn't your family doctor. It's just another business. And sensational headlines get clicked. What often gets buried is the fact that 3 out of 4 people will carry HPV at some point in their life in their own body without any symptoms. Yes, that common. In India, sexually transmitted infections carry huge stigma, even though many everyday things are technically sexually transmitted. Some even joke that our birth itself qualifies. Cervical cancer is one of the most common cancers in women and is primarily caused by HPV. Right now, hundreds of thousands of Indian women have cervical cancer, and 99.7% of those are caused by HPV. If every citizen in India was tested today, most men and women would show HPV in their system. So, a positive HPV test does not mean a woman has multiple sexual partners. Often, we test precisely to protect patients. HPV thrives under silence. Many women don't speak about gynecological issues or read up on them, giving the virus room to cause harm. Even today, many educated people hesitate to believe cervical cancer is caused by a virus, and that's partly because science itself took centuries to figure it out. How we discovered the real cause of illness? For centuries, people blamed sickness on divine punishments or past life sins. In 17th century, René Descartes proved science should run on logic and evidence. René Descartes is called the father of modern philosophy. Yet, even today, you can hear claims blaming sins for women's cancer. Science moved on, attitudes didn't. After Descartes came false science. Cough and bile was thought to be the cause of all diseases. Then, the miasma theory, blaming bad smells and dirt for diseases. In 1848, Dr. William Henry Duncan dug 140 miles of drains in Liverpool to improve public health. It worked, so people assumed filth alone caused disease. Hygiene mattered, but germs, bacteria, viruses, fungi, parasites, and prions are the real players too. Louis Pasteur in 1861 proposed microbes cause disease. Robert Koch confirmed it in 1880 with the germ theory of diseases. We learned germs cause diseases. So yes, HPV awareness took time. Even a few years ago, our medical textbooks still blamed poor hygiene for cervical cancer well into the internet-free era. Many couples think we have only been with each other, so there is no risk. But HPV can hide in the body for years before showing up. This fuels mistrust. The husband treats sexually transmitted and doubts his partner. Relationships suffer when it is often just biology. Let's be clear. Multiple sexual partners do increase the risk of new HPV infections and cervical cancer. There is no doubt about it. But a positive HPV result is not proof of infidelity. Since men are not routinely tested, HPV is usually found in women, leading to unnecessary suspicion and heartbreak sometimes. Myth number 2. HPV automatically means cancer. HPV is present in almost everyone's body, but that doesn't mean everyone gets cancer. Most HPV infections clear up naturally within 2 years with the help of a healthy immune system. People with lower immunity are more at risk. Smokers, those on regular steroids for asthma or kidney issues, people who skip exercises, stay up late, or live under chronic stress all the time. In some cases, science still doesn't fully understand why immunity runs low. When the body cannot clear HPV, it may stay and lead to 6 types of cancer: cervical, vaginal, throat, penile, and anal cancer in men. Persistent HPV infection is usually the culprit. Nearly 90% of HPV infections disappear within 2 years, often without us even knowing. A 2025 study by Dr. Tassendair showed that stronger immunity helps the body fight HPV more effectively. So the takeaway? Boost your immunity the natural way. Medications won't do it. Regular exercise, balanced meals, fiber, proper sleep, and stress control will. Myth number 3. HPV is not a disease, it's a virus, and it comes in over 200 subtypes. Think of it like pulses: moong, musoor, chana. They are all lentils, but slightly different. Out of these 200 plus HPV types, only about 14 are linked to cancer. The rest are harmless. Myth 4. You can tell if you have got HPV. Unlike a cold or stomach infection, HPV doesn't show obvious symptoms. It lives quietly in the body, which is why many, even educated people, assume they don't have it. The lack of symptoms make testing essential. Screening tests can catch HPV and cervical changes early, long before any symptoms appear. The pap smear test, named after Greek doctor Giorgio Papanicolaou, was discovered through his research on his wife Mary. Today, upgraded versions of these tests are widely used for early detection. WHO has long recommended a few key screening programs, but awareness remains low and most people skip these life-saving tests altogether. Myth 5. There is medicine for HPV. No antibiotic or antiviral drug can kill HPV. The best line of defense is HPV vaccine before the problem starts, ideally taken in childhood. How many doses and at what age? We have got a detailed resource link on that below. If you are already infected, your strongest medicine is still your immune system. Stay healthy, retest periodically, and if you have had high risk HPV, and remember, low risk types often linger harmlessly in the body. They are like long term tenants, not invaders. Be brave and get yourself tested. Otherwise, staying healthy would be a constant struggle and your body won't build proper immunity. Take some time to really understand the science behind it. It truly matters. Life is tough as it is. Let's not make it harder with misunderstanding that could break someone's peace and relationship. That's all today. See you soon with another research article.